is the pulmonary exam. And the pulmonary exam includes inspection, percussion, palpation, and auscultation. So let's start with inspection. I'm going to first do everything on the back of the chest, at the back of the lungs, and then we'll go anterior. So the first thing that I'm going to do at the back is just inspect. And what am I looking for? I'm looking for any kyphosis or lordosis, any scoliosis, any structural abnormalities of the thorax that could influence or affect the patient's ability to breathe, and everything here appears symmetric and normal. The next thing I'm going to do is palpate. And really the major part of palpation that is really important to do is check for excursion, which basically checks for the patient's symmetrical expansion of his thorax. So what I do is I place my hands on either side of the thorax, and I'm paying particular attention to where my thumbs are. And they're pretty much at the same distance from the midline of his back. The next thing I'm going to do is ask him to take a good deep breath in. And you see how my thumbs, and you can breathe out. So you saw how my thumbs symmetrically expanded and moved away from one another and then moved towards one another. And that was normal. The next thing I'm going to move towards is percussion. Percussion takes a little bit of practice. And the best way to percuss is I use my middle finger and I percuss with my middle finger, and I use my wrist for motion, right? And so what I'm doing is I'm just tapping right at the base of my fingernail, and what I'm trying to listen for is resonance. The lungs have air in them, so you should hear a sort of a resonant or somewhat hollow echoing sound when you percuss. And so you're going to percuss side to side. And if you notice, I went side to side in 3 areas. There is one way that you can increase the sensitivity or increase the surface area over which you percuss. And the way to do that is to move the scapula out of the way by having the patient fold his arms over and across his chest. Now what you've done is you've opened up the scapula and you've opened up a little bit more area of lung to percuss. So I percussed in three levels in the back. Next, I'm going to percuss under the axillary area. And again, it's resonant to percussion. The next thing I'm going to do is auscultate. And the best way to auscultate is, first of all, have the patient take good deep breaths with their mouth open. And again, if you're going to notice, I'm going to compare side to side. I'm not going to go down one side and go down the next side. I'm going to compare side to side as the patient inspires and expires. So whenever you're ready, just take some deep breaths for me. I'm then going to auscultate under the axilla. Great. Now, if I hear something abnormal when I'm auscultating, I'm going to do 2 extra tests that will give me a little bit more information. The first one is called vocal fremitus, and I'm also going to show you the tactile fremitus. Fremitus basically means vibration. And so what I'm trying to do is see how well the sound that he makes vibrates through the lungs through my stethoscope to my ears, all right? And the best way to do that is by having the patient say 99. So whenever I place my stethoscope on your back, just say 99 for me, please.
99, 99, 99, 99, 99, 99, 99, 99.
Great, thank you. So how do I know something's wrong there? When he's saying 99, I'm really testing for differences in vibration across the back. So you might notice areas of decreased vibration. That could be the scapula. It could be because there's fluid blocking the transmission of that sound through of the fremvitus through your stethoscope, and it could mean that someone has a pleural effusion, a pneumonia, or something else. Now I'm going to teach you tactile fremvitus, which is basically the same concept. I'm going to have him say 99, but I'm going to use my hands to feel for any vibratory differences, right? And you're going to compare side to side. So whenever I put my hands on your back, just say 99 for me.
99, 99, 99, 99, 99, 99, 99.
Okay, thank you. You must check at least 3 areas, but if you noticed, I checked about 6 or 7 areas, checking for asymmetry across the back. The last special test I'm going to perform is egophony. And again, I only perform this test when I hear something on routine auscultation that makes me concerned. Egophony is another technique of assessing for abnormalities in sound that is transmitted across the back or the chest. And so egophony is basically the conversion of sound from when the patient says E to when I listen with my stethoscope, I hear A. Okay, that's called egophony. So what I'm going to have you do is every time I put my stethoscope on your back, please just say E.
E, 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 E.
Okay. So every time I placed a stethoscope on his back, I heard E, which is what he said. That's normal. For example, if someone has a pneumonia or consolidation or fluid inside the lung tissue, when he says E, it's going to sound like A to me, because the presence of extra material in fluid is going to distort the sound that I hear. So now I'm going to do the same thing on the front. So just inspecting for any abnormalities, any kyphosis, any abnormalities in inspiration, and there are none. The next thing I'm going to do is percuss the anterior part of the chest, just like I percuss the back. Now the front of the chest, like the back, the most complete and thorough way to do this is to check in 3 areas, percuss in 3 areas. So we've covered inspection, we've covered percussion, and again, I'm going to go to auscultation, and I'm just going to have you take deep breaths with your mouth open. Keep in mind 2 things. Lung tissue is all the way up here. So if you noticed, I listened pretty high. Number 2, the other thing to note in women, we're going to teach you how to maintain modesty for women while still removing breast tissue out of the way so that you can auscultate appropriately. Now again, let's say I had heard something abnormal on auscultation. Then I would check for fremvitus and I would check for egophony. So I'll check for fremvitus first. And again, just like you did before, whenever I place the stethoscope on your chest, just say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, and I'm going to do the same thing for tactile fremvitus.
99, 99, 99.
And then egophony. So whenever I place my stethoscope on your chest, just say E.
E, 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 E,